Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha and good morning. Thanks so much for tuning in here to Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yanji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. Great to see so many of you already entering your comments and questions here this morning as we speak to the Lieutenant Governor once again, Yanji.
That's right. He's joining us live from his office at the state capitol. Welcome, Dr. Green. Good to be with you this morning.
I'm sorry, I can't hear you guys right now. I don't have any volume for you.
Okay, how about now? Do you hear us now? Still not yet. Okay, well, we're going to try to work that out for a second. He's going to be in and out. We want to talk, of course, the Lieutenant Governor, and please type your questions in the comments while we work out these technical difficulties. We saw what looked to be a good number today, 380 cases.
Excellent.
And Lieutenant Governor, can you hear us now?
Yeah, sorry about that.
All right, no worries. So let's get right to the news. We get that number now around 9 o'clock every morning. 380 cases reported today. That's a big drop from what we've seen in the past. Some of us hoping to breathe a sigh of relief, but we were talking before the show started and you're saying not so fast.
Well, yes. Thank you for having me again. 380 cases today. Positivity rate stayed identical, 7.22%. There are very few tests done this weekend because it was the Labor Day holiday, and a lot of testing sites were less available, or people didn't go out for tests because we asked people to stay in. But it is still good news. It shows that we are having a plateau at the moment. I think it's safe to say that our optimism should be pegged at that we're seeing a plateau in the cases, a plateau in the number of hospitalizations. We'll talk about that, I'm sure, in a moment. And if things do go along the lines of what's going on in the mainland, they've begun to see a drop off of the Delta variant cases. The mainland got up well over 12% positivity rate. They're now down to 9.37%, and we've been tracking about 3% below them. So, I'm also looking for optimistic moments. And though we are certainly on COVID tsunami watch for the Labor Day weekend, that's really where we are. We want to make sure that we don't have that COVID tsunami from gatherings over the weekend. But we're optimistic here in my office because we have not seen gigantic numbers persist.
We want to bring in a question here. Speaking of the hospitals, Kaipo is asking, please ask Dr. Green about the threshold of 500, referring to the hospitalizations. What are the numbers right now that we're seeing with the hospitals? Because we know that is a statistic that you pay especially close attention to, given our limited resources.
Yeah, I'm glad that's the first question we have. The number of people in the hospital is the most discrete number that we can rely on, because we can actually count the people in the hospital without fail. That number today is 436. Yesterday it was 441. The day before that it was 440. The day before that was 433. Our last 10 days, the range has been from 418 people in the hospital to a peak of 448, with an average of 436, which actually is today's number. So that is a very good sign that the overall bulk of illness has plateaued. Though, again, we are being very cautious and careful not to get too far ahead of ourselves. We have the 620 visiting healthcare providers, the critical care nurses and respiratory therapists here in the state helping our healthcare system. It's really coming at a perfect time as we've gone to this surge. But I have seen more discharges in the last 24 hours, and that's another great thing. So that 500 number is a real line in the sand. If we reached 500 people in the hospital for COVID, we would be unfortunately having to pose that critical question, which we should never have to ask: do we have to ration care? I would also add that 91 of the individuals today in the hospital are in the intensive care unit, and 73 individuals are on ventilators with COVID. These are pretty high numbers, but again, that's been very steady for the last, say, 72 hours. So people should not, again, breathe a total sigh of relief, but we're hopeful that we've plateaued. Let me let me break this out a little bit better for people. You saw the governor signed an order last week that talked about whether or not we would have to ration care. It's called crisis standards of care, meaning if hospitals reach a point where they cannot actually deliver all the services that we would expect here in our state, in Hawaii, across the country, that they then would have to begin to ration care. And from my perspective, we should never allow that to happen. We should do anything possible to prevent that from happening. And the way to stop that is either getting a lot more people vaccinated or getting more healthcare available. Now, some of those considerations are not easy. As you know, there are still 177,000 individuals who have chosen not to get vaccinated. They're pretty susceptible to COVID. And 3 to 4% of them, if they catch it, will end up in the hospital. And then there's the hospital side where we can bring extra personnel in, but even we have finite services like oxygen or medications. That's why I've been so concerned about that number of 500. But, you know, say a small prayer tonight that our numbers are plateauing and then subsequently dropping.
Well, going back to that 500 number, staying with that for a second, you know, part of the issue, as we know, is that when we see those case counts, it can take 2 days to 2 weeks for those individuals, roughly 4% from our conversations in the past. That's sort of the number that you had given us before, that could end up in the hospital. So given that we had all of those really high numbers in the last 2 weeks, isn't it sort of inevitable that we will hit that 500?
It's inevitable that we will see more hospitalizations. We have 11,067 individuals who are actively positive right now. As we talked about right before we came on, that is a proxy for the number of active cases. That's the number of cases that have occurred in the last 2 weeks that we've been able to confirm. 3.5% to 4% of all those individuals will end up, if the numbers hold historically, will end up needing hospitalization. So that's upwards of about 400 additional people going to the hospital. However, there's a couple tricks that we have up our sleeve, okay? One is we're rolling out antibody care right now, more antibody therapy. So we'll talk about that in a second. Two, although we will have 350 to 400 additional individuals in the hospital, we will also discharge many individuals from the hospital because they're getting better. And we've, averaged a 4 to 7 day length of stay in the hospital. So people will be getting discharged while new people come into the hospitals. Also, we added some kind of auxiliary healthcare system in the form of those tents that can do outpatient care for not severely ill people. We haven't had to utilize those too extensively yet, but that's yet another way we can decompress the healthcare system. And then I've got one last trick up my sleeve, which is in conversations with some healthcare professionals who we have a great deal of respect for, we have another option. And we've just begun to explore this, but the Hawaii State Hospital, which has not yet opened for full service, it's not taking care of any new patients. That is a facility that is as yet untouched. It's not staffed right now, but with this large surplus of additional staff coming into the state of Hawaii, that might just be one answer. If we got terribly close to that 500 number, where some of our hospital facilities, as they needed to find new places to discharge patients, we could possibly put some individuals there in a clean, safe, very well equipped new hospital. So there are a few ideas out there that I constantly game out with my team just to make sure that we never reach that place where we would have to ration care. I don't even like to say it because it's so toxic to me to imagine we'd ever have to choose between two people that we love. Forget whether vaccinated or unvaccinated. Let's just talk about giving everyone care in Hawaii till we get through this crisis. And so it's anathema to me to imagine not giving one individual care just because they were in some other category of chronic disease or age. We can't do that. So we'll do everything we can to avoid that. But the best thing we can do, the easiest thing we can do, is not gather and spread COVID amongst ourselves and get vaccinated, because if you're vaccinated, you have a very low likelihood of ending up in the hospital. Please take to heart this recommendation, because that's a lot easier and a lot more straightforward than all of these other options.
I want to follow up a little more on that idea that you just floated out there with the Hawaii State Hospital. Of course, this is a new facility on the windward side of Oahu that was recently completed after years of construction and money that has gone into that facility, as you mentioned, not utilized at the moment. What would activating a facility like that include, and who would staff that? And when would that decision be made that this is a facility that might be needed?
Well, I floated that idea about 15 minutes before we got onto our call. So some of it is very early. It's just something that occurred to us as an option because they have been preparing to, in the near future, begin to transfer their patients from the older facility to the new facility. It has not happened yet. It would have to be fully staffed by support from the FEMA team, would be my expectation. Although we do have some people that have been sitting on the bench and might like to volunteer and participate in this kind of care. It would not be like having care at Queens or Straub or Kaiser. It would be for people who are getting discharged or who needed some isolation and quarantine to take the pressure off of the system. So it would require much less intense staffing. I would envision care no more extensive than getting some basic oxygen therapy and then being restful and isolated, getting meals and so on. Kind of what we did with isolation quarantine, but we never had enough capacity to keep all of the people isolated in quarantine that we would like to. It could be done quickly. It's not that challenging because we have a small team that we always bounce ideas off of quite quickly. It's just a few calls. It's a better option in many ways than trying to set up a field hospital or sending people home when maybe they needed another couple of days of care. So these are the kind of things that I'm always advancing as ideas, just in case. This is a just in case scenario. Hopefully our case counts will continue to plateau and then begin to really drop in the hospitals. I was optimistic to see it actually go down by 5. We do tend to get discharges on Tuesdays and Wednesdays in the week. And then the weekends, the numbers climb a little bit, but we don't have a lot of extra wiggle room here. So that's why this idea came about. I've already spoken with some of the principals and we'll be able to share more in the next couple of days. But again, we're just looking for many options for our people because as everyone knows, the state of Hawaii, though we are an extraordinary state, we do have a limited healthcare footprint.
And how much of a buffer could that give us? What's the capacity that you could see of folks who could go there? What kind of, pressure would that alleviate on the system for those who need that intensive critical care that we're talking about? And how soon could that be stood up?
100 to 140 people. It could be stood up within a week without any difficulty. The real question would be, is it something that we have to do because we have otherwise surpluses elsewhere? There are a lot of long-term care facilities that also would like to take patients, but it's a little bit difficult for them to mingle individuals who have recently had COVID in with their elderly clients. That's not something we would want to do normally because the risks of infecting one of our kupuna. So this is just another option, but it's a good one if we are pressed to the max. And so I want people to know that we are constantly working on these options because, again, it's a toxic idea to have to ration care. It's really not acceptable. So that's why these other ideas emerge. I could see it happening, actually, especially for discharges who feel more comfortable having essentially a visiting nurse level of care at their bedside, as opposed to going home. I have a friend who recently had their 91-year-old father discharged after just 2 days in the hospital. He's doing very well, but needless to say, they're pretty concerned. This is a very old gentleman who could quickly decompensate, and having him in a bed with a nurse checking in every few hours really, I think, would have been quite palatable to them. So that's one thing to do. And then, of course, there's other modalities of care that we're using to decrease the number of hospitalizations. I think you've heard by now that FEMA is helping us set up some monoclonal antibody sites. Now, before people think that this is going to be the panacea for this crisis, understand this. We would use monoclonal antibodies for people who are not so sick that they have to go into the hospital, instead to prevent hospitalization. It tends to be for those who are fully unvaccinated. They caught COVID and they want to avoid going into the hospital. And we give them a dose or two of monoclonal antibodies, and that has tended, in general, across the country to decrease hospitalization and death by 70%. This is the kind of care that the president and some of the governors, I think the governor of Texas, took when they caught COVID. Essentially, it's like giving what your immune system should be able to provide, that first blast of antibodies. And so we're setting that up for what looks like to be hundreds of people in the coming weeks. Once again, just trying to prevent our hospitals from, reaching that critical number of 500.
One of the things that we always look forward to when you come on our show is a lot of questions, and we're certainly getting a lot of questions from the audience here, and we're trying our best to summarize them as best as we can. There seems to be still questions about testing and why more testing is not made available, especially for those that are coming into the state. We know that was a part of the Safe Travels program, and that there are some lawmakers who are calling for the reinstatement of some pre-testing of some sort, whether it be before travel or upon arrival to the islands. Do you foresee any sort of re-implementation of testing requirement to enter the state?
It does not appear that the governor is going to do that. I can't speak for him. I can only give ideas and best ideas to the whole team. There are a couple challenges, and I don't know if people saw the previous show, but what happened was the CDC, in their advice, in their guidance, has decided that vaccination cards, if people are fully vaccinated, are safe to travel. And that is the standard right now. Therefore, if a state tries to apply a secondary standard like mandatory testing before travel to avoid quarantine, it will not stand the test of legal challenges. And that's been the input that we've gotten on several occasions at the highest level in our state. So it's very difficult to make that stand up. And I know that it is an optimized approach because I helped write it. I helped develop that approach, and it worked. But people should also know that only 1% to 2% of our cases have been from visitors. The rest of the cases that we've had, unfortunately, have been from community spread. So I know that that's hard for some people to digest, but it just happens to be a fact. Also, doing that, which would spend an incredible amount of our testing capacity, would make it very difficult for us to test for the new programs that the mayors and the governor have proposed. I know that they are controversial. That's like the testing program if you're going to go into a restaurant if you're not vaccinated, or testing if you choose not to be vaccinated but you still want to be a state worker, having to test once a week. That takes a lot of testing, and that testing is being absorbed by a system that just doubled. We doubled our testing capacity from about 5,000 tests a day to 10,000. That's why sometimes, we get these delays in results that drive us all crazy. Well, that's because we're testing so much and their systems are, always trying to catch up. So these are challenges. I have had people tell me that we absolutely should have a pre-test and a post-arrival test and test 3 times a week. The truth is that would be hundreds of thousands of tests when we can only do about 10,000 tests in our small state. These are just some functional challenges that we have. The best thing we can do if we want to stop COVID, the easiest thing is just to have people be vaccinated or not gather. And then, of course, wear masks and hand wash. It's not rocket science. And I really want to emphasize that. We've done well now. We're now at 64.7% of our whole state is vaccinated. That's 5th best in the country, it appears. And we're at 72.9% for all those individuals in the country initiating vaccination. Again, top 5. And then when you set aside the kids, the 203,000 children that are under age 12 and can't yet be vaccinated, we're at 84% of all those eligible in the state have been vaccinated. That just leaves 177,000 people that for whatever reason just will not get vaccinated. And that's where the Delta variant has been roaring through our society. And unfortunately, most of those individuals make up the hospitalizations. 87% of all of our hospitalizations are amongst people who are unvaccinated. So the picture is quite clear. As much as I would love to have every layer of security, some of them become just practical impossibilities. And the best thing we can do is not gather, get vaccinated.
There are a number of questions here about children. We'd love to ask you about how the pediatric cases are doing. And one of the things you mentioned with the antibody treatments is that is for unvaccinated folks. Noreen's got this question. Can children under 12 be given the monoclonal treatment?
I'm sorry that they can't. It's only over age 12. It's been approved for. It's also just emergency use authorization. Here's an interesting wrinkle, and I'll address this question in a couple different ways. For one, it is kind of surprising to me that suddenly individuals who have refused to be vaccinated, don't want to be vaccinated, are amenable to taking monoclonal antibodies intravenously or subcutaneously. That's kind of a shocker because, frankly, the vaccine is much less of an issue. It's been studied in hundreds of millions of people now, and it's very safe and has not had many side effects, whereas monoclonal antibodies are a lot more cutting edge. But I do support their use, but it's only over age 12, so we can't use that for kids. And I've seen the number of cases. We've had about 18 to 22% of all of our cases amongst our kids. That's 0 to age 17. Sorry to call teenagers kids, guys. My apologies to Maya out there right now. But for younger people, that's been about the percentage. The good news is, and it's not 100% good news, is that very few have required hospitalization. Less than 1% of all of our children who have caught COVID have required hospitalization. And as of right now, there's only one individual, and one is, of course, too many, of our keiki who's in the hospital requiring advanced care in an intensive care unit. Just one person, as opposed to, well, I mentioned it earlier, 91 total in the ICU statewide. So 90 are adults and 1 is a child. 73 individuals total are on ventilators, and 436 people are in the hospital overall. So it has been a small proportion, but as a father, I worry about that just like you guys.
We have a question from Stephanie here. She wants to say, what are your thoughts on the current vaccination rates that still remain far under that 70% threshold? We know that that was the initial threshold before this Delta surge, and we've spoken to a number of health officials on this program who say that number will probably have to be higher than 70% at this point with the cases that we are seeing now with Delta. But why do you think we still remain under that 70%? We've been sitting at around 60, now at about 65. For about 2 months now. It's taken some time. Your thoughts on where we're heading with this vaccination process?
Well, so the rate slowed down to just a trickle to about 1,200 vaccinations a day before the Delta variant started rolling through, because the people who refused to be vaccinated just weren't swayed. They just don't want to do it. And that was a problem. So that was 1,200 a day. Now we're closer to 5,000 vaccinations a day on average, because people realize that the Delta variant is spreading rapidly, and they are aware that most people in the hospital are unvaccinated. So that kind of lit a fire under our society and has multiplied by about 4 times the number of people that are getting vaccinated each day. So now we're getting 0.2% of the population completing vaccination every day. So we bump up 1% every 5 days. Got to go a full 5%, right? So in about a month, it looks like we'll get to 70%. So in a month, we should be close to 70% fully vaccinated. And in that same month, maybe 5 weeks, we'll be at about 90%, 90% of all of those who are eligible will have started vaccinations. There's a very strong likelihood that our case counts will drop like a rock at that point, because that's a lot of people with immunity. But I cannot say that I've got a crystal ball. I mean, there are definitely some wrinkles. We saw the Delta variant was tough. We now have the Mu variant, MU, that seems to have kind of just settled down, has not been significant in our state, but that was potentially evading some of our antibody responses. So we just have to be ready to kind of roll with the punches. The most important thing is to make sure we have adequate hospital capacity to keep people alive, and that we continue to encourage our society to get vaccinated, because it's the smart thing to do. You know, I wish that we got there faster. You're talking about individuals that are actually taking the time to rebel and protest leadership and do caravans and those kind of things. That's just, that's a very strongly held belief. And I've reached out to many, and I understand that there are differences of ideology. I really do. But I still also say follow the science and keep yourself safe. But this last 177,000 individuals, they're not super into getting vaccinated. If they were, they would have gotten vaccinated 3 or 4 months ago.
I want to ask you about the programs that some of the counties are doing. There's Safe Access Oahu that they're going to be starting on September 13th here on Oahu. Safe Outside is the Maui County version of sort of the same thing. Do you think that these programs will make a difference in terms of controlling the spread, or do they simply act as more incentives for people to get vaccinated?
I'd say they're likely to be an incentive for people. They're likely to have an impact on that side, where an additional percentage of people, maybe 15 or 20% of the people, will just throw their hands up and say, okay, once and for all, enough of my friends have gotten vaccinated. It's been fine. I need to do this in order to participate in some programs outdoors or at restaurants. I'm going to do it. I have concerns overall. I'm just trying to be as honest as I can. I have concerns about mandates, or I have concerns about these programs, because though they're smart as far as health safety and public health, and I commend the mayors for that, there is definitely a divisive nature in society about vaccinations or vaccination cards. And now that we in Hawaii have reached such high numbers compared to other states, this 83 or 84% of all those who are eligible to get vaccinated, I'm wondering if we couldn't have just convinced half of those people through good science to get vaccinated, because there's a lot of oppositional defiant behavior going on right now, which might not be necessary. But again, let me commend the mayors for doing all that they can to keep people safe. At the end of the day, this is just a vaccine. We've been getting vaccinated for measles and chicken pox and polio for generations to keep our families and our kids safe. And this is not really any different. But we live in a new age where people can watch things on social media and they can spend a lot of time indoors obsessing about different reports that are mostly phantoms. Unfortunately, that is made for a conspiracy era that has unfortunately left a few people unprotected. And what did it mean? It meant that our hospitals overflowed with patients.
There seems to be still many people who are commenting, asking for restrictions, saying that there is a time where we would have considered locking down, say during the pandemic last year. At this point in time now, we continue to have some restrictions, but no official lockdown or any serious restrictions in terms of gathering sizes and having businesses shut down. There are some health officials who have also called within the state for further restrictions. Do you believe that we do need some sort of next level of restrictions? And what would be that threshold mark for you to make those decisions? And what would that look like?
Well, it's a great question. So just so you know, last Monday, I called for those restrictions for a Labor Day pause. In other words, safer at home. And that was the right thing to do. Unfortunately, we didn't do it, but they did do a good job with law enforcement, and I appreciate that. There were fewer gatherings in aggregate than we normally would have had for Labor Day, but we should have locked down so that we didn't run the risk of pouring gasoline on this COVID fire. Now, you also know that there's another threshold out there, which is the number of hospital beds we have. If we touch 500 individuals in the hospital, we darn well better restrict gatherings at the very least. And I mean a total restriction of outdoor gatherings unless you're in one's family bubble, because that's how the cases are being spread. If the case counts reach a point where we cannot keep us under 500 in the hospitals, we'll see too many people pass away that shouldn't. And that's not acceptable to me as a doctor or as lieutenant governor. That's really the threshold for restrictions. What we can hope is that today's number is relevant, the 380, that is a sign that we're declining. We can hope that the hospitals plateauing over the last 10 days is also a sign that we're not seeing a further super surge in our hospitals and that we won't have to do it. The argument against lockdowns, just for those who are watching, is that 84% of all of our citizens have gone the extra mile to get vaccinated, to at least begin the vaccination so that they are safer, so we don't see spread, so that they can go on with their lives, whether it's businesses or going to work, going to school, seeing their grandkids. In fairness to them, a lockdown is too harsh. But from a societal standpoint, when the hospitals are meant to care for us, whether we've got COVID or heart attacks or cancer or knee replacement surgery or anything, we're all in this together. And that's why we cannot allow too much spread, because if spread continues, we could get the entire fall as a surge. And if the surge occurs throughout the fall, you know what that will mean to the holiday season. We'll be locked down. That would be devastating to the state of Hawaii. Once again, that's why I called for the Labor Day pause. But I'm keeping my fingers crossed. I'm rooting for lower numbers every day. I wake up praying that we're going to see a lower number based on people sensibly wearing masks, not going to gatherings, and getting vaccinated.
There's a comment here from Susan, which I'm seeing from a lot of people, which is they don't want to lock down because of money instead of the health of the people. Is there a way to thread the needle so we essentially, if we have to do more restrictions, somehow satisfy both? Because when we talk about a lockdown, I think in a lot of our minds, it goes back to March and April of last year, where everything is completely closed. When you talk about having some more restrictions so that perhaps you can only be in your, in your family bubble, does that mean that retail stays open, for instance, but you have to go in and out? Like, is there a way to have a lockdown or have restrictions and also not completely annihilate local business?
Yes, that's the safer at home category. And so let me say this directly to you, Susan. I'm with you to a point. I understand what you mean when you say that we're not locking down adequately because we should put health first. And we do have to put health first. But if we put health first to the point of locking people down totally and businesses close and we have no economy, what does that mean? That means that we don't have monies to keep the hospitals open or to pay for these visiting nurses or to keep our schools open or to have people pay for their food. All of these are consequences of total lockdown. We had definite problems with poverty. We had incredible challenges with nutrition for our children when schools were closed. So it's not a simple answer about being open and therefore keeping the economy going. Actually, being open means taking care of people's health. And remember, the vaccination program has protected most people from severe illness. So it is a balancing act. But I, as a physician, would always err on the side of keeping people alive. It's an incredibly complicated task to know what exactly will keep people safe from COVID and also safe from all of the other consequences of not having a life, like their job, being able to take care of their children, and so on.
Well, unfortunately, we are out of time, but we did want to allow you one final message that you have for those tuning in here this morning.
Well, my final message would be, guys, continue to be safe. Do not gather unnecessarily because we can begin to see the downslope of this COVID curve. In the next 2 weeks, we will know whether or not there was a surge from Labor Day activities. I'm hopeful against hope that we will not see that. Each day, my team, through social media or whatever you prefer, I think we're at LTGov Josh Green, will give people updates on the number of cases in the hospital, the number of cases overall. But do your part. Convince friends or family to get vaccinated if they're not. Otherwise, convince them to not gather, and then our cases will drop. Hawaii has the lowest mortality rate in the whole country across the whole pandemic. We actually have also the lowest total cases per 100,000, but we're such a small state that we're vulnerable to surges in our hospitals. So by doing your part, by being extra safe, you're saving the lives of your neighbors, your family, your friends. So thank you for that commitment. I hope that doesn't sound too dramatic, but I'm really worried about people right now, and we're really still at the tipping point. So please be safe these next 2 weeks.
Okay, Lieutenant Governor Josh Green joining us from his office at the Capitol. Thank you for taking all of these questions and for sharing your ideas with us this morning. We really do appreciate it.
You bet. Take care.
Thank you. Mahalo.
And one of those ideas that, Ryan, is a new one that we've just heard for the first time, and he said it's an idea that he's just sort of started to float around this morning, is the idea of turning the state hospital that is a facility designated for the mentally ill that has not yet opened on the Windward side, a facility, multi-million-dollar facility that took years and plenty of effort to build, to turn that into sort of a secondary hospital as opposed to opening up a field hospital where they would staff that with these traveling nurses and perhaps some Hawaii folks as well. And that would sort of, alleviate some of the pressure that we're seeing on that hospital. He said it could house between 100 and 140 people. Again, these are not people who are critically ill, but people who are sort of in between and who right now might be clogging up the system at the hospitals.
We know that those long-term patients do also provide some issues with hospital staffing, as well as just the overall capacity of each of these facilities. And so this is an idea that, again, it's just an idea that he has floated around. By all means, it will have to go through a number of different departments and individuals, and ultimately the governor, before anything like that gets implemented. But just one of the things that he's saying that he's continued to look for as hospitalizations continue to remain steady at about that 430 level. Again, him saying that threshold of 500 is going to be a point where further restrictions would have to be put into place, saying that there may be a way to, as you put it, thread the needle between a all-out lockdown and maybe something that provides restrictions on gathering sizes, but still allows businesses to stay open. And of course, we've also heard that he is optimistic about the numbers that were reported today as well.
Yeah, but he did caution that the numbers are low because there was less testing. So the positivity rate stayed the same, it's just that fewer tests actually occurred. Still, it was nice to see that 380 number today, but we wait for when there is more robust testing. And on the issue of testing, so many of you in the comments, we see all that you said, and a lot of it very critical of the way we are allowing visitors into our state without requiring testing before they get here and also testing post-arrival. He said that, ideally we would do a lot of those things. He says that he is hamstrung by federal rules that don't allow that. I know some of you have been challenging that, saying that statute is wrong. And then also just by our own testing capacity, that now we can run about 10,000 tests a day. If we test all the visitors that come come in, that would simply overwhelm the system and we couldn't do all the testing that we need to do, which is actually expanded now because of these requirements for various employers, including the state and county workers, to be either tested weekly or have a vaccination.
Yeah, we know that this, in fact, is an issue that the Honolulu City Council will be taking up as well. So we'll wait to see more information. And clearly, there are a lot of frustrations. There's a lot of emotions out there in the comments, some of them directed directly towards us, but we can handle it. And we want to thank the Lieutenant Governor for being on the show. On Friday, we continue on in our conversation, speaking with leaders that are having to battle this, and this time focusing on a different community.
That's right. We're going to be talking to Hawaii Island Mayor Mitch Roth. Hilo Hospital there, we had them on a few weeks back, and now we understand that their ICU is completely full and overflowing. He has set their gathering size on that island to 10 indoors and 10 outdoors. He's been the strictest on gathering sizes. So is that having any impact? We'll be talking to Mitch Roth on Friday. We do hope you'll join us then. Bring your questions and your comments. Hopefully nice ones to us, but as Ryan said, we can't take it. And we really thank you for watching today. And please encourage someone, if you know someone who's not vaccinated, please encourage them to go do so.
We'll see you here on Friday. Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.